Mishtenko. I'm the Service Delivery Manager for the Security Operations in the Midlands at Samsic, and I'm a mental health first aider. The reason I got into mental health first aid was just to really understand how I can best support the workforce of Samsic, because we're all part of the same family, we're all part of the same company, and if I was in their position, I'd want my manager to be fully equipped to be able to support me as much as possible in every way possible. So that's why I really got into mental health first aid to start with, and Samsic were fantastic in facilitating that. They had specialist training from an outsourced provider. They came in, assessed everyone to make sure that we were in a good position to deliver the mental health support ourselves. And then from there, they helped us talk about the signs of safeguarding, how to identify vulnerable people, and the do's and don'ts, which is really important, because that came down to, that we're not psychiatrists, we're not there to give medical advice, we're just there to support and be someone to listen to and almost like a shoulder to cry on. Samsic are fantastic for making sure we get absolutely everything we need in regards to supporting our staff as effectively as possible. That includes additional training, constant updates from Able Futures, emails out from HR with just general best practice, updates to legislation, and we have an external body that come in once a year and help offer some retraining and just assess all of the mental health first aiders to make sure not only that they have all of the knowledge that they need to support the workforce appropriately, but also to make sure they're in a good place mentally to do so. I think the most common stigma that I've encountered in the workplace in regards to mental health is people saying, man up, get over it. It's not that simple. If you've got something physical wrong with you, like the flu or, a cold, whatever, that's easily treatable. You can go to the doctor, you can get some tablets, and, you can get a Lemsip or whatever. Mental health's different because it's so hard to pinpoint what actually the root cause of people's mental health issue is. It's not always a chemical imbalance in the brain that leads to depression. It can be lots of external factors, family issues, things going on at home, even just external things like if you've had a bad conversation at work or a bad experience and you've taken that home and let it fester and fester and fester, these things can just snowball so quickly. So having one key cause, it's just never possible. In my experience, it's always a mishmash of things, lots of contributing factors that have just gotten the better of people. The support program we have in place is absolutely fantastic. It's brilliant. If, let's say, for example, you want to raise a mental health first aid case for yourself, you could speak to your line manager and say, look, I'm not feeling great. I've had this and this go on. Is there anyone who can help me? Straight away, that manager can speak to HR. They can speak to all of the mental health first aiders that are on the list that gets distributed to everyone. And then we can arrange to reach out. The process for opening a new mental health first aid case is actually very simple and straightforward. If you're a Samsic employee and you're not feeling at your best, you can email the mh@samsic email address, and a member of the first aid team or a member of HR will reach out to you directly and they'll start providing you with all the support you need. Alternatively, if you're not comfortable speaking to someone directly from Samsic, we have a really good external service called Able Futures, and they're really great to work with. They've got years and years of experience, and we tap into them for a lot of our resources as well. We have a symbiotic relationship that allows us to support all of our staff in the best way possible. To guarantee the confidentiality of all cases raised, the confidential email address can only be accessed by members of the mental health first aid team and HR as well. So none of their line managers can ever get access to that information, just to ensure maximum confidentiality, which again just gives all of our employees that extra layer of security and safety and reassurance that we're not here to discuss anything. We're here just purely to help and to ensure that they're getting every bit of support that they need.